welcome Dr. Shah, a plastic surgeon. You do all kinds of plastic surgery at Mercy, right? Facial plastic surgery and...
Body plastic surgery, body contouring, hair transplant, we do it all.
Okay, everything. And today you are going to talk about one of the two ways to fix forehead wrinkles. They both start with a B. The other one is bangs. But some of us can't do bangs, so you're going to tell us about Botox.
Sure. So Botox is a very common FDA-approved treatment that we do in the medical spa. It takes about 15 minutes, and within about a week, you get your results. So it's very simple.
Yeah, and it's so popular, right, with men and women. Why do you think it's become so popular? I mean, it's exploded.
I think people are surprised by how many men get Botox, but really it's a non-surgical way to look good. There's no recovery time, so it doesn't cut into your schedule. It's very simple.
Yeah, unlike a lot of the things that you see, I used to walking around Beverly Hills, people with their faces plastered or swollen, or it's not attractive. But as we'll see in just a minute, you were gracious enough to let me take a camera in to show one of the procedures that you did. It's not scary at all. It's actually, very quick. The patient said it was painless, so and she's actually going to be here to tell us how painless it was. But what I love is the concept of a facial plastic surgeon coming in to tell us how to avoid getting plastic surgery in the future. You're not undercutting your own business.
It is kind of funny. There's a lot of things that have changed recently, and that's that patients don't have time to recover. So we don't have time to recover from a facelift or other procedures, and we want something that can tune us up and get us back to work right away without having to take that time. And the non-invasive treatments have really taken off. Things like Botox, other injections like fillers, and then other treatments, laser resurfacing, Ultherapy, which is an ultrasound skin tightening. Those are ways to have your procedure and go back to work the next day and gradually get your results.
That's excellent. And a lot of people are concerned, though. We've all seen those awful pictures of celebrities who have the frozen faces or they've got way too much stuff in their lips, or
yes.
How do you avoid doing that?
So the key is not overdoing it. It's making sure that patient can still look like themselves, only better. So what we want to always think about is a tune-up or a touch-up. It's not a major overhaul.
Okay, and of course people come, how often do people come in for touch-ups for Botox?
Botox lasts about 3 to 6 months. Okay. So if you're really lucky, it might last for 6 months. But otherwise, it usually lasts about 3 or 4 months. So it's a very simple visit.
Yeah, and the key is to make them look like themselves, only better. I love that. Well, let's take a look at the procedure that you did. And this is Sherry. You were talking about kind of some of the lines that she has.
Yeah, so
what are you doing there?
Sherry just has some mild lines around the eyes called crow's feet, and also some frown lines between the brows. And so it's very simple to treat. This takes, again, about 10 minutes. And what we're doing here is just prepping the surface and getting ready for the injection. The injections are done with a very tiny needle. It's 32 gauge. It's one of the finest needles they make. And as you can see, it's not uncomfortable at all. We place the medication directly into the muscle that causes the wrinkle. And after about 4 or 5 days, the medicine starts to kick in. And what you find is, even if you try to make that wrinkle, you can't.
Okay, but you can still make expressions. Is that right?
Yes, you can. And the key to that is just injecting the muscles that you want to treat for the wrinkles and being conservative about how much medication you use.
Okay, and so you don't see this as an end-all. It's not like you have to freeze the whole face like sometimes people think.
Not at all. You can be very subtle about it, and I think you can really, again, help prevent wrinkles from happening.
Okay, well, now we invited Sherry in, and we get to see. Hi, welcome, Sherry.
Thank you.
Well, I have to offer you a margarita.
Why?
It's Margarita Day.
I'll pass it on.
And Dr. Shah, I know you're on call, so
right.
you won't be imbibing with us. But show us the results. Can you guys get a close-up on her face? You look beautiful. Of course, you were beautiful before, but it looks just smooth. Your skin just looks radiant, and you look smooth. You can smile?
Yeah.
Can you look really mad at me? Oh, see, I got it. I knew that you were mad at me. That's the thing is I think a lot of times people don't realize you can still be expressive.
Right.
Your face isn't frozen.
To me, you have more of a rested look.
Yes, that's a good description of it. Now, of course, we have to ask you, Sherry, did it hurt?
No, it's like tiny little pinpricks.
So that's not bad.
No,
and
not at all.
I saw you afterward. We didn't have an right after picture. You literally could go right back to work. It didn't look like you had even any bumps on your face at all.
I did go right back to work. Didn't replace makeup, didn't do anything. Just went straight back to work.
Yeah, that's awesome. And it took, just minutes.
Minutes.
Yes. In a really nice
Very nice
office
setting.
too.
Yes.
Yeah, that's nice too. I tell you, in Beverly Hills you can get Botox in a strip mall, which is not what you want. But you can go to a plastic surgeon here and get great results really quickly. Thank you so much for showing us. And cheers to Margaret.